Good evening. Welcome to Friday Reading Live. My name is Vandana PS, one of the reading trainers from Neethu's Academy. So, I'm just giving you a gentle reminder. So, this is the first day of November, and we have 3 exams coming. So, on the very next Saturday, we have an exam. Okay, so are you guys preparing for the exam? All right. So I'll give you a sample question from part B, plus I will explain about part B in detail in this live segment. As well as let's deal with the self-prepared material for part B also, part A also. And here comes the question, so please do the question. Yes, welcome back. Good evening once again. Yes, Nimmi. Yes, good morning, Nimmi. Hi, Sharanya. Good evening. Shanta, Shiny, Sankita, Beulah, Grishma, Jilba, and Shanu. Good evening. Yes, Imi, good evening. Good evening, everyone. Yes, so what about this question? Okay, I'll just read this question, then we will discuss the answer. And before that, I'll explain about part B in detail for the students who are going to write this exam in this month and for my students who are preparing for this exam. Okay, all right. Thank you so much, Neethu. Yes. Anyway, so what about this question? So what about part B? So I'll explain about part B first, then we will discuss this question. Okay, in part B, we have total 6 number of questions. Okay, namukku etra questions undavum part B la? 6 questions in part B. See, just imagine. So we have to complete this 6 questions within 12 minutes. Okay, so roughly you will get 2 minutes for the completion of one question. Clear? So just imagine, we should have a calculation regarding the number of questions and the time. So time management is very important, and you don't have any separate time for doing part B and part C. Together you will get 45 minutes. Okay, and out of this 45 minutes, we are taking maximum 12 minutes for the completion of part B. So roughly you will get 2 minutes for the completion of one question in part B. Clear? So this is all about the time. So according to that, you can prepare and you can manage your time. All right. Then, so definitely you have a doubt regarding, okay, what technique we can apply to do part B, or what is the strategy to apply, we can apply in doing part B. So any idea? Let me know in the comment box. Hi Amrita, good evening. Yes. Santwana, good evening. Rebecca, good evening. Yes. Lini, good evening. Yes. Neethu, good evening. All right. So what strategy we are applying? Yes. Amrita, Rebecca, yes, tell me. Yes, Santwana. What is the strategy we are doing in part B to complete part B? 6 questions within 12 minutes. What is the strategy we are using? നമ്മൾ എന്ത് സ്ട്രാറ്റജിയാണ് പാർട്ട് ബിയിൽ യൂസ് ചെയ്യുന്നത് to complete these 6 questions? Very good. Yes, Shanu, we are using elimination method in part B. Okay, so what is elimination method? So please do listen to this live session. I will explain what is elimination method by doing a particular sample question from part B. But before that, what is to be noticed in part B, because as I already informed earlier, we have 6 questions in part B, and the 6 questions can be categorized into 3 different categories. നമുക്കൊരു 3 category of questions ആണ് part B യിൽ usually വരുന്നത്. Okay, so what are the 3 different kind of questions, or what are the 3 categories of questions in part B? So the first category of question can be called guidelines. Okay, so what are guidelines? So when you do a question, if you are seeing, okay, this is a guideline, idoru guideline aanu ennu ningal കാണുമ്പോൾ എന്ത് ചെയ്യണം? Automatically you have to remember, okay, guideline എന്താ? What is a guideline? So what is a guideline? A guideline, which means a set of rules and regulations that we should follow. Nirbandhamayittum, it is compulsory, it is necessary, it is important, we have to, we should, we must. Okay, so we should follow the set of principles, maybe the set of rules and regulations, instructions in a guideline. Okay, we have to. So which line is important in a guideline? Always the first sentence is important in a guideline. Okay, all the lines are important, of course, but we are just focusing to the first sentence a little bit more, because the first sentence is always important in a guideline. Okay, and what are you reading for in a guideline? എന്തിനു വേണ്ടിയാണ് നമ്മളൊരു ഗൈഡ്ലൈൻ വായിക്കുന്നത്? We are reading for the details. I hope it is clear. Okay, so details, what is a detail in a guideline, or what are the details in a guideline? So details, which means a set of rules and regulations, already I have told you. Okay, ഞാൻ നേരത്തെ പറഞ്ഞ പോലെ തന്നെ we are reading for the set of principles, instructions and recommendations. So we are reading for the details. What are the details? Clear? So that is the first category. So when you read a guideline, always you can see a lot of words like must, have to, need to, important to, required to. Okay, followed by, abide by, adhere to. So likewise, a lot of words which indicate some, element of something wanting or compulsory, which is mentioned here, in the guideline. Clear? Okay. And coming to the second category, yes, Beulah, first line of the first sentence is important. Hi, Elizabeth, good evening. Okay, Nemmi, we are using elimination method. Yes, Beulah, elimination method. Okay, Shiny, elimination method. Yes, Shanta, elimination method. Hi, Glenn, good evening. Yes. Okay, Shanu, elimination method we are doing. Yes. Okay. Yes, Jishi, good evening. Okay, so what about the second category? Let me know in the comment box. What are the second category in part B? ഏതൊക്കെയാണ് second categories എന്ന് പറയുന്നത്? ഒന്ന് comment ചെയ്തേ. What are the second category of questions in part B? Yes, let me know in the comment box. What are the second category? Yeah, so second category, which means we have manual, policy, or manual or policy. Okay, so what is a manual? Manual എന്ന് പറഞ്ഞാൽ എന്താ? What is a manual? So again I'm saying, when you deal with the question and the question category tells you that this is a manual, and you have to think, okay, this is a manual. So what is a manual? So manual, which means a small booklet which gives you all the information about a particular machine, a device, maybe an equipment or an instrument or a medicine, a particular device, a particular medicine, a particular drug, a particular instrument, a particular device. So likewise, manual which gives you an information about a particular thing. That means there will not be any connection with animals or human beings. In the sense, connection illa ennu parayumbo patient side connection ille ennoru thought varum undu. I'm thinking about, or I'm talking about, if I'm saying there will not be any connection with animals or human beings, in the sense, enganeyana, we can say this manual is not related to patients. Manual is all about that machine. For example, this manual is talking about a microscope. Or a microscope aanennu vicharikka. And we have to deal with this manual to know about, what are the pros and cons, or how can we use this microscope? What are the speciality of this microscope? How this microscope is functioning? So it's all about that particular thing. That's what I'm said, or what I said. Okay. Yes, okay. Okay, Sangeeta, yes, devices, equipments, medicines, yes, follow the steps in manual. Okay. Yes, Banu Kumar, policy and manual, that's from the second category. Very good, Simi. And what are you reading for in the manual? Yes, we are reading for the main idea. So think about main idea. What is the main idea? What do you mean by main idea? എന്താണ് നിങ്ങൾ മെയിൻ ഐഡിയ കൊണ്ട് ഉദ്ദേശിക്കുന്നത്? So, as I informed, when you deal with the manual, for example, it's all about a microscope. Then what is the main idea of the manual? Okay, how the microscope is functioning. To know about the main speciality, the main idea of the microscope, we are reading manual. Clear? Then second one is policy. What are policies, or what is a policy? So policy, which means same like guidelines. It can contain maybe a one particular rule, maybe one particular act, or a one particular code of conduct, or a particular recommendation that we should follow, or the staff should follow, or the members should follow, or all the professionals should follow. Okay, so again it is compulsory. But how can we identify, or how can we differentiate between a guideline and a policy? I can say you can differentiate in this in the base of government rules. Okay, guidelines, we can say it's not related to the government, may not be, but in a policy it is related to the government, the authority. Okay, by law. Clear? So that is a policy. That is in the second category. So which lines are important here? Policy എന്ന് പറയുമ്പോൾ ഏതൊക്കെ lines ആണ് important ആയിട്ട് വരുന്നത്? We can say the first 3 lines or the first paragraph is important. Maybe you can eliminate from the first 3 lines, or you will get the answer from the first 3 lines. Okay. Then what about the third category? So it is very easy to remember, because first category only one document is there, guideline. Second category 2, manual, policy. Third category 3. First one is email. Second one, memo. Third one, notice. Okay, so email, memo, notice. So what is an email? എന്താണ് email എന്ന് പറഞ്ഞു? Yes. Okay, so yes, Rebecca, first 3 lines are important in second category. Very good, dear. Yes, Rebecca, manual, which means information about a machine, device, instrument, or a medicine. Very good. Okay, Santwana, manual and policy, which comes under the second category. Yes, Nimi, we are reading for the function of this particular device. Yes, Nimi, first 3 lines are important. Email, yes, Mega, email, memo, notice. Yes, Nimi, email, memo, notice. Yeah. What is an email? Email, what is an email? And email, which means we can send a particular information to someone. For example, I'm sending an information to Rebecca. Okay, so what is my purpose? Maybe I'm just sending an email to Rebecca, and Rebecca, maybe she's my manager, and I'm sending an email to Rebecca to indicate or for the request of a leave. Okay, I'm applying for leave. So likewise, I can send an email to Rebecca, and what is my subject here? Application for leave or leave application. Okay, so that is the subject line. So in an email, there will be a sender. I am the sender. Who is the receiver? Receiver, the manager. And there will be a subject line. So what is the subject line? Leave application. So likewise, there will be a sender and receiver and a subject line in an email. Not always all the time, but 99% there will be that. And memo, same like an email, we are sending to someone to pass a particular information. Same in notice also. Okay, but the only difference between an email, memo as well, a notice is that email and notice we are sending, and as I already mentioned, there will be a sender or a receiver and there will be a subject line. But in a notice, it is for everyone. Okay, ആർക്ക് വേണമെങ്കിലും നോട്ടീസ് വായിക്കാം. But email and memo, it is a little bit, private. Okay, maybe for a group of people. For example, in hospital, we can send an email to all the staffs. It's not for the patients, not for the doctors. Okay, so email and memo, it's a little bit more specific. Okay, so that is the third category. Yes, Banu Kumar, sender and receiver will be there. Okay, so yes, second. Okay, Drishya. Okay, you have mentioned that code here. Anyway, second policy, main idea, first 3 lines are important. Very good, yes. Okay, so coming to third category, email, memo, notice. What are you reading for in an email, memo or notice? Yeah, let me know in the comment box, what are you reading for? നിങ്ങൾ എന്തിനു വേണ്ടിയാണ് വായിക്കുന്നത്? An email, a memo or a notice? Yes, we are reading to understand the purpose. Okay, so what do you mean by purpose? As I already mentioned you, I already have given an example. So leave application. നേരത്തെ പറഞ്ഞല്ലോ leave application or application for leave. So what is the purpose here? എൻ്റെ ഉദ്ദേശം എന്താണ്? What is my intention here? I just need some leave. എനിക്ക് കുറച്ച് ദിവസം ലീവ് വേണം അല്ലേ? So that is my need, that is my purpose. So we are reading to understand, okay, what the overall idea, the purpose. So which lines are important here? All the lines are important, of course, but we can focus to the last lines. Especially last lines are important. I hope it is clear. Yes. Okay, Sangeeta, we are reading for the purpose. Yes, Shiji, overall idea. Yes, Manju, we are reading for the purpose. Okay, purpose, yes. Very good. Yeah. So, coming to this 6 questions. So what type of questions? I category of questions ningalod paranju. And what do you mean by the type of question, or what are the type of questions? Only one type of question is there, multiple choice questions with 3 answer options. Okay, so we have multiple choice questions with 3 answer options. Clear? And we are applying elimination method here, and out of these 3 answer options, we have 3 chances. നമുക്ക് 3 chance ആണ്, 3 probability or possibility of options here അല്ലേ? For sure one will be the correct answer. ഏതെങ്കിലും ഒന്ന് എന്തായാലും correct answer ആയിരിക്കും. Okay, and in remaining 2 options, one will be contradictory or opposite option, and one will be it is not mentioned option. So these are the chances. ഒന്നെങ്ങനെയായിരിക്കും? Contradictory to the question, or opposite to the paragraph, or contradictory to the paragraph, or one will be not mentioned. അത് കൊടുത്തിട്ടുണ്ടാവില്ലേ? Okay, so this is the chances of options here. We have 3 options. Okay, so I'm gonna show you what is elimination method in this particular question. Okay, and I hope the screen is visible. Yes, Nimi, last lines are important. Okay, Sangeeta, last sentences are important. Okay, so coming to this question, so what is the first step? And I'll give you 5 simple steps. Okay, ഇപ്പോൾ എക്സാം എഴുതാൻ പോകുന്ന സ്റ്റുഡൻസ് പ്രത്യേകം ശ്രദ്ധിക്കുക. ഒരു 5 സിമ്പിൾ സ്റ്റെപ്സിൽ നമുക്ക് പാർട്ട് ബി കംപ്ലീറ്റ് ചെയ്യാൻ പറ്റും. ആൻഡ് ഇഫ് യു ഗൈസ് ആർ ഫോളോയിങ് ദ സ്റ്റെപ്പ്, ഡെഫിനറ്റ്ലി യു ക്യാൻ സ്കോർ 6 out of 6. ഒരു ഡൗട്ടും ഇല്ല. ഓക്കെ, ഡെഫിനറ്റ്ലി യു ക്യാൻ സ്കോർ 6 out of 6. ആൻഡ് പ്ലീസ് ഡോണ്ട് ബി ആബ്സെൻറ്റ് മൈൻഡ്. നിങ്ങൾ എന്താ പറയുക, ഇത് പറ്റുമോ, 12 മിനിറ്റ്സിൽ കംപ്ലീറ്റ് ചെയ്യാൻ പറ്റുമോ, അല്ലെങ്കിൽ എന്താ ഞാൻ ചെയ്യുക, ഇതിൻ്റെ തന്നെ ക്വസ്റ്റ്യൻസ് ഇതൊക്കെ തന്നെ ചോദിക്കുമോ? ഡെഫിനറ്റ്ലി. ഓക്കെ, അതർ ദാൻ ദിസ് 3 category they will not ask you any other questions. So please do understand the category first. ഏത് കാറ്റഗറി എന്നുള്ളത് നമ്മൾ മനസ്സിലാക്കിയെടുക്കുക. ദാറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ് തിങ്. Okay, so here the purpose of the extract from the policy on seasonal influenza management is to. Okay, so what are the keywords from the question? And this is exactly like it looked like your exam model material, a sample question. So what are the keywords? So that is the first step. You can read the question. Ningal adem question vaikka. Okay, so done. Second one, underline the keywords from the question. Question and the keywords underline ചെയ്യുക. Keywords എന്ന് പറഞ്ഞാൽ എന്താ? What are keywords? Keywords which means important words from the question. Not all words are important. അല്ലേ? എല്ലാവരും ഇമ്പോർട്ടൻ്റ് ആണോ? അല്ല. ചില ആൾക്കാരാണ് നമുക്ക് ലൈഫിൽ ഇമ്പോർട്ടൻ്റ്. അതുപോലെ in a question all words are not important. Okay, so we can underline certain important words from the question. Those words are called keywords. Okay, അപ്പോൾ നമ്മൾ keywords underline ചെയ്യുക. So what are the keywords here? Already it is mentioned purpose, extract. I'm not underlining purpose, extract. So yes, policy. I'm underlining the word policy. Then what is another word which I'm going to underline? Influencer. Then management. So likewise you can underline separate words from the question. I'm just very slowly I'm saying this because the only thing is that എത്ര പ്രാവശ്യം നമ്മൾ പറഞ്ഞാലും എന്ത് ചെയ്യും നിങ്ങൾ? You will underline a group of words. അല്ലേ? നമുക്ക് ആ ഒരു ടെൻഡൻസിയാണ്. Okay, the policy on seasonal influenza management, the purpose of the extract. So likewise you guys are underlining a group of words. Please don't underline a group of words. It will confuse you. Okay, so please do underline important single or individual words from the question as well as from the paragraph or from the option. എവിടെ നിന്നാണെങ്കിലും ഇൻഡിവിജ്വൽ വേർഡ്സ് മാത്രം അണ്ടർലൈൻ ചെയ്യുക. ഡോണ്ട് അണ്ടർലൈൻ ഗ്രൂപ്പ് ഓഫ് വേർഡ്സ്. ക്ലിയർ? ഓൾ റൈറ്റ്. So policy, influenza, management. And this question is incomplete question. Okay, so majority നിങ്ങൾക്ക് കണ്ടിട്ടുണ്ടാവും maybe എന്താണ്, at the end of the question there will be a full stop or there will be a question mark most of the time. But there is no full stop, there is no question mark in this question, and that is called incomplete question. ഇതൊരു incomplete question ആണ്. So that means if you find an incomplete question, you should connect with your option. It will be very easy to identify the answer. It will help you to identify the answer very easily. Okay, so seasonal influenza management is 2. So likewise you can connect with your options. So first step done, second step done. So what is the third step? Understand the question. Question മനസ്സിലാക്കണം. Otherwise your answer will be wrong. Okay, question മനസ്സിലാക്കാതെ അയ്യോ ഓപ്ഷൻ എന്താണ്, പാരഗ്രാഫിൽ എന്താണ്, no chance. Okay, answer correct ആവാൻ യാതൊരു ചാൻസും ഇല്ല. So please do understand the question. So what is the question here? This is a policy. Okay, so I know policy, which means it is a rule from the government. Okay, then so I'm just marking it is from the second category, a policy, and I'm reading for the main idea here. Then what is next? The first 3 lines or the first paragraph is important. So likewise I'm just imagining or I'm thinking that cognitive purpose is important here. Cognition, thinking. Okay, so moving to the next one. Explain the procedure, reading the option and next one I will read the paragraph, then I'll do the elimination. Okay, explain the procedure for establishing isolation facilities. So explain, then procedure, facilities. These are my keywords. Second one, seasonal influenza management is to identify the staff responsible for moving patients into isolation. So identify, responsible, then moving. So these are my keywords from second option. And third one, seasonal influenza management is to outline the procedures for the care of patients in isolation. So my keywords, outline, procedures, care. Done. Okay, now I will read the paragraph. Seasonal influenza management policy, isolation. Okay, patients with suspected flu will be admitted to a single room. So if it is suspected, doubtful ആണെന്ന് തോന്നിയാൽ റൂമിലേക്ക് മാറ്റുക. That's it. Patients with confirmed flu will remain isolated in a single room or cohort bay for the duration of their infectious period or until discharged. In confirmed aanengilo, they will be isolated from everyone. Okay. If a patient requires ventilatory support, a negative pressure room in the ICU should be used. Ventilatory support vendi vanna nirbandhamayittum you should admit them into ICU. So from the first 3 lines, already I have told you first 3 lines are important. From the first 3 lines, to which option we can trace? നമുക്ക് ഏത് ഓപ്ഷനിലേക്ക് ട്രേസ് ചെയ്യാം? ഓക്കെ, അഗെയിൻ ഒന്നുകൂടെ ചെക്ക് ചെയ്യുക. എക്സ്പ്ലെയിൻ ദ പ്രൊസീജിയർ ഫോർ എസ്റ്റാബ്ലിഷിംഗ് ഐസൊലേഷൻ ഫെസിലിറ്റീസ്. ഈ 3 ലൈൻസ് വായിക്കുമ്പോൾ നിങ്ങൾക്ക് ഒരു പ്രൊസീജിയർ ആയിട്ട് തോന്നുന്നുണ്ടോ? ഒരു വൺ മെത്തേഡ്? ഇസ് ഇറ്റ് ഓൺലി അബൌട്ട് എ വൺ മെത്തേഡ്? ഐ ഡോണ്ട് തിങ്ക് സോ. സോ മേ ബി നോട്ട് ഓപ്ഷൻ എ. Identify the staff responsible for moving patients into isolation. Nothing mentioned about staff in the first 3 lines. Third one, outline the procedures for care of patients in isolation. Yes. Why? Patients with confirmed flu will remain isolated in a single room. എന്നിട്ട് എന്താ ചെയ്യുക? Then patients require, if a patient requires ventilatory support, എന്ത് കൊടുക്കണം? ICU should be used. So I am tracing towards option C from the first 3 lines. Maybe. No idea. In such cases, a discussion between a respiratory physician and site management must happen. So if the patient needs any kind of ICU support or something, then you can discuss it with what? A respiratory physician and site management must happen. If it becomes, again it comes under the care, patient kodukkunna care alle. Okay. If it becomes necessary, sufficient single rooms or cohort areas will be designated for patients with confirmed and suspected flu by hospital management. Again, option C. Isolation patients may undergo investigations in other departments, provided the relevant department has received advance notification. While outside isolation, the patient should wear a surgical mask. Again, it's one of the care. The area and any equipment that patient has been in contact with should be appropriately decontaminated on completion of the investigation. So, maximum traces. So that is elimination. When you read the text itself, you should eliminate. വായിച്ചുകൊണ്ടിരിക്കുമ്പോൾ തന്നെ നമ്മൾ എന്ത് ചെയ്യുക? ട്രേസ് കൊടുക്കുക and try to find out the answer and try to eliminate options. Very simply I can eliminate option A because it's not about a particular procedure. ഒരു procedure ആണോ ഇത്? Is it all about a method? Of course not. So contradictory or opposite option. These are set of procedures, care plans. Identify the staff, not mentioned. So answer is option C. Outline procedures for care of patients in isolation. That is the correct answer. Clear? So very simply, with this 5 simple steps, you will get the correct answer. Sheriyale? Yes. So let me know in the comment box how many of you have got C, option C. Yes. Okay, Geetu? Yes, Sankita? Okay, Shiny? Yeah, so a lot of options C I can see here. Any doubts? Any doubts in part C? Sorry, part B? I've explained in very detailed way. So anyone attending this live session, I mean any students, exam എഴുതാൻ പോകുന്ന students ആരെങ്കിലും കാണുന്നുണ്ടെങ്കിൽ please do attend this live segment every day. It will help you to gain full marks. I can say full marks, yeah, of course. ദിവസം കാണുന്നവരാണെങ്കിൽ definitely you can score full marks. Because reading is the only module you can score 500 out of 500. ശരിയല്ലേ? Okay, and this is like an open book exam. So please do study, please do prepare, please do focus. Alright, so now we are moving to the self-prepared material for part A, and we have a new topic here which is abdominal dialysis. Okay, abdominal dialysis. And before moving to this material, I think I will explain about part A in detail, and it will help you to find out the answers very easily. I don't know how many students have done this material. നിങ്ങൾ ചെയ്തിട്ടുണ്ടോ? Yes. Okay, Sangeeta. Yes, procedures, which means it is plural. Number of steps mentioned. Very good. Yes. A lot of methods mentioned. അല്ലേ? ഒരുപാട് procedures ആണ് പറഞ്ഞത്. Yes. Yeah. Okay. Okay, Geetu. Shanta, Shiny, Meka, Nimmi. Yeah. All right. Yes. Done. Okay. Okay, Nimmi. Very good. Yes, Shanta. Okay. How was the material? Again, under the material. Was it difficult? Very good, Rebecca. Okay. So, was it difficult for you guys? Difficult the material because I've done a material, I've prepared a material just like your exam model material. എനിക്ക് തോന്നി ഒരു exam model material തരണം. So I've just prepared an exam model material for you guys. Okay, definitely this material will help you, and this is just like your exam model material. Okay, yeah, so tough material. All right. Okay, Megha, it was easy. Yeah, because you are attending this live session every day, right? Yeah, I know. Okay, so coming to this material, this is all about abdominal dialysis. All right, so I'll read this material, underline the keywords, because already you know about how to underline the keywords, right? From the previous live session. Yes, you guys know how to underline the keywords from the text. Okay, so 4 text, 4 text ആണ് അല്ലേ? Abdominal dialysis, sometimes called peritoneal dialysis, is an intervention treatment that takes away residues എന്ന് പറഞ്ഞാൽ എന്താ, wastes and contaminants, which means what, toxins from a person's blood when their kidneys cannot operate capably. Kidney damage often becomes worse over many years due to health issues such as diabetes mellitus, high blood pressure, a group of diseases called glomerulonephritis. Yes, glomerulonephritis, which damage the part of kidneys that filter blood, genetic diseases including one called polycystic kidney disease that causes many cysts to form in the kidneys, use of medicines that could damage the kidneys. This include heavy or long-term use of pain relievers such as aspirin, ibuprofen, Advil, Motrin IB, others, and naproxen sodium or Aleve. Okay, and these are my keywords from text A. Okay, so this is a very small text, but it's very tough. Okay, tough in the sense that some meanings are not familiar to you. I think residues ningal ariyarikkum, but maybe somebody find it difficult. Residues, which means again waste, and contaminants, which means toxins. Okay, yes. Then I'm moving to text B. There exist 2 varieties of abdominal dialysis. 2 varieties. ഇപ്പോൾ നമ്മൾ ഓർത്ത് വെക്കുക. Okay, 2 varieties എന്ന് പറയുമ്പോൾ, so 2 categories, 2 types, 2 kinds. Okay, continuous ambulatory peritoneal dialysis or CAPD. CAPD is a machine-free manual procedure. The patient needs to connect the tube to the catheter, the dialysis bag to empty the dialysis fluid in the belly and later drain it. This process needs to be repeated 3 times a day. Each exchange takes 30 to 40 minutes. Automated peritoneal dialysis, which is APD, it's also called continuous cycling peritoneal dialysis, involves attaching a catheter to a machine called a cycler. This process involves sending the dialysis solution to the person's abdomen through the machine. Automated cycler or machine performs multiple exchanges throughout the night while the person sleeps. The cycler automatically fills abdomen with a solution, allowing it to stay there. Drain the solution along with waste into sterile bag. Person has to remain attached to the main machine throughout the night, 10 to 12 hours. So these are my keywords from text B. Again, a very small text. Then text C. Abdominal dialysis may lead to possible implications such as which means again complications, ramifications, difficulties, weight accumulation, weight gain. The solution used during peritoneal dialysis contains sugar. Patient's body might absorb the dialysate that can add hundreds of extra calories, causing weight gain. If the patient has diabetes, extra calories can lead to high blood sugar. Infestations, which means infections. For peritoneal dialysis, a catheter is placed inside the patient's abdomen. An infection can develop near the catheter. The risk is higher if the person is not properly trained for the procedure. An infection of the abdominal lining can also develop due to peritoneal dialysis. So these are my keywords from text C. It's not yet completed. Yeah, incompetency. Okay, so ineffectiveness. Incompetency, which means ineffectiveness. Peritoneal dialysis becomes ineffective after continuous use for several years. The patient then needs to shift to hemodialysis. Then hernia. To filter the blood, dialysis solution is sent to the abdomen It says in the body, and after the blood is filtered, the solution is removed along with the waste. This procedure holds the fluid in the abdomen for a long duration, may strain the abdominal muscles. And moving to text D. Okay, so here we have a pictorial. So definitely one text will be a pictorial of something. We have no idea. Maybe a table or a graph you can expect, or a flow chart like this. Okay, so one of the texts will be a pictorial. Then patients who received PD therapy more than or equal to 3 months and agreed to attend this research during January 1st and June 30, 2009, which is 382. Age less than 18 years, which is equal to 8. Excluded group. Okay, so you can expect a lot of questions from this particular pictorial for sure. History of tumor, which is 19. From the other centers, which is 35. Acute infection or hospitalization within 1 month, which is 43. Patients with dementia or psychotic disorder, which is 2. Then final subjects included 275. Depressive, which is 86. And non-depressive, which is 189, followed up until June 30, 2019. Oh my god, it's covered up. Yes. Okay. Deaths. 39, dropped out PD, 40, switched to HD, 21, renal transplantation, that means kidney transplantation, 16, transferring to other centers, number 2, lost to follow-up, 0, other causes, 1. Again, deaths, 72, dropped out, 93, then switched, 34, renal transplantation, 43, transferring to the other centers, 8, lost to follow-up, 7, other causes, 1. Okay, a lot of numbers. So, I've underlined all the keywords which are important. Clear? ഇതൊക്കെ തന്നെയാണോ നിങ്ങളുടെ കീവേഡ്സ്? ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? നിങ്ങളുടെ കീവേഡ്സ് കമൻറ്റ് ചെയ്യാനല്ല, ഇതൊക്കെ തന്നെയാണോ ഒന്ന് കമൻറ്റ് ചെയ്യാം. Okay, so now I'm just jumping to the first 1 to 7 set of questions which can be called match the following questions. ഇവിടെ നിങ്ങൾക്ക് എക്സ്പെക്ട് ചെയ്യാം എന്ത്? Maybe they can ask you repeated. Answer will be repetitions. Okay, അതായത് ഇപ്പം ടെക്സ്റ്റ് എ, മേ ബി ഇവിടെ ടെക്സ്റ്റ് എ ആയിരിക്കും, ഇവിടെയും ടെക്സ്റ്റ് എ ആയിരിക്കും, ഇവിടെ ബി ആയിരിക്കും, സി ആയിരിക്കും, ഇവിടെ ഡി ആയിരിക്കും, അഗൈൻ ഡി ആയിരിക്കും, ബി ആയിരിക്കും. സോ ലൈക്ക്വൈസ് യു ക്യാൻ repeat your answers. Okay, no problem. Yeah. So what about question number 1? An expression for a variant of peritoneal dialysis primarily performed at night. Okay. So yes, we remember that word night. ഓർക്കുന്നുണ്ടോ? നൈറ്റ് എന്ന് നമ്മൾ എവിടെയോ പറഞ്ഞു അല്ലേ? സ്ലീപ്പിംഗ് 10 to 12 hours. See, I remember that. So expression, variant, night. These are my keywords from the question. ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? What are the keywords from the first question? നിങ്ങളുടെ ഫസ്റ്റ് ക്വസ്റ്റ്യൻ എന്നുള്ള കീവേഡ്സ് ഒന്ന് കമൻറ്റ് ചെയ്തേ. കറക്റ്റ് ആണോ എന്ന് ഞാൻ ചെക്ക് ചെയ്യാം. Let me know the keywords from the first question. Yes, Megha. Okay, Shanta. Yes. Okay, Nimmi, Shiny, Geetu, Grishma. So yes, what are the keywords from your first question? Question in the keywords on the comment ചെയ്യാമോ? ഏതൊക്കെയാണ് കീവേഡ്സ്? ആൻസർ ഒക്കെ കറക്റ്റ് ആണ്, ഐ അഗ്രി, ബട്ട് ഐ ജസ്റ്റ് വോണ്ട് ടു നോ വാട്ട് ആർ ദ കീവേഡ്സ് ഫ്രം ദ ക്വസ്റ്റ്യൻ. നിങ്ങളുടെ ക്വസ്റ്റ്യനിലെ കീവേഡ്സ് ഒന്ന് കമൻറ്റ് ചെയ്തേ. Don't be lazy. Please do comment your keywords from the question. Very good, Shanta. Yes. Okay, so your keywords: expression, variant, night. Very good. Performed night. Okay, Megha. Okay, Beulah, primarily. Okay, fine. No problem. Okay, I found expression, variant and night. These are my keywords. Maybe for you, your keywords will be variant, primarily, night, or primarily performed night. Whatever, we can underline maximum 3 keywords from the question. Okay, Nimi, night and variant. Very good. Yes, Shiny, expression, variant, night. All right. Okay. So we are moving to the answer. So what about the answer? Correct answer is? Okay, Rebecca, variant, expression, night. Yes, Grishma, night. All right. Variant, dialysis, night. Very good. All right, Shanu. Coming to this question. Answer is B. Okay. Which is mentioned here in text B. So where is it mentioned? See, this is the procedure. Okay, so 2 varieties of abdominal dialysis mentioned here, which is CAPD as well as APD. Automated peritoneal dialysis. As you can see here in middle of the sentence, automated cycler performs multiple exchanges throughout the night while the person sleeps. See? So this is the procedure we are doing at night. Answer is mentioned in text B. Yes, Monita, very good. Let me know your answers. Yes, Priya, night is your keyword. Very good, dear. So Monita, Rebecca, Shanu, Grishma, Geetu, Shiny, Nimmi, Meka, Shanta. Anyone else? Very good. Okay, that is the correct answer. Second question. Explanations why dialysis patients may encounter subsequent weight increments. Explanations. Here explanation doesn't mean that we need a detailed explanation. Doesn't mean description. Here explanation which means reasons. Okay. Reasons why dialysis patients may encounter, experience subsequent weight increments. Weight increment which means weight gain or weight accumulation. So where is it mentioned? Where is it mentioned? Reasons for dialysis patients to experience subsequent weight increments or weight gain, weight accumulation. Very good. Answer is mentioned in text C. Already you have done this material, but I don't know whether you guys have listened to my explanations of underlining the keywords. So definitely if you have attended this before, previously, you can answer this question for sure. Alright. So answer is mentioned in text C. Where is it mentioned in text C? So the first point itself. Weight accumulation. Solution used during peritoneal dialysis contains sugar. Patient's body might absorb the dialysate that can add hundreds of extra calories causing weight gain. Alright, so answer is mentioned in text C. Yes. So what about question number 3? Alright, yes, Grishma, Shanta, Shiny, Nimmi and Monita, Geetu, Shanu. Yeah, C. Very good, text C. Third one, let me know the keywords. I'm not underlining the keywords, I just want to know your keywords. One underline cheythe. What are the keywords from third question? What are your keywords from third question? Let me know in the comment box. Contributing factors that promote the development of cyst in the kidney. Very good, Shiji. Promote. I will underline Shiji's keyword, okay? Promote, development, cyst. Yes. Any other keywords? Anyone? Contributing factors that promote development of cyst in the kidneys. So these are the keywords. Promote, development, cyst. Where is it mentioned? Contributing factors. Factors here which means contributing elements or factors. Okay, so contributing factors that promote development of cyst in the kidneys. Where is it mentioned? These are the contributing factors. Yes, Shanta, contributing. See dear, contributing factor is a combination of words. So you can underline contributing, comma factor, comma development. Oh, contributing one word, factor second word, development third word, cyst fourth word, in fifth word, the sixth word, kidney seventh word. 7 keywords. Okay, so this is what I told you. Please don't underline a group of words. You can underline single words, individual words. Contributing, one word. Development, another word. Cyst, the last word. So 3 words. Okay, so we need only 3 words. Answer is mentioned in Shari. Okay, Shari. Factors in development. Very good, dear. Yes, answer is mentioned in text A. So where is it mentioned in text A? As you can see here, in text A, what are the contributing factors? Kidney damage often becomes worse over many years due to health issues such as diabetes mellitus or high blood pressure. Okay, as well as, yes, Shari, Nimi, Geetu, Shanta, Megha, Monita, Shiny, Shanu, Shiji, Megha. Answer is mentioned in text A. Very good. That is the correct answer. Fourth one. Main site for the initiation of infection following peritoneal dialysis. So my keywords, main site, initiation. Already we have read about infection in some text. Alright, so where is it mentioned? Main site for the initiation of infection. And it's very clear for me. Yeah, already I got the answer. Anyone else with the correct answer? Fourth question. Any idea? What is the correct answer for question number 4? Main site for the initiation. Very good, Shiny. Your answer is correct, dear, which is mentioned in text C. Infestations. For peritoneal dialysis, a catheter is placed inside the patient's abdomen. An infection can develop where? Near the catheter. So, answer is here, which is from text C. Fifth one. Reasons behind the exclusion of numerous patients. Very direct answer. Reasons, exclusion, patients. So, answer is mentioned here in text C, and these are the reasons if the patient is not more than 80 years or history of tumor from other centers, acute infection, patients with dementia or psychiatric disorder. So, answer is mentioned in, again, it's mentioned in text D. Alright, yes. Yes, Megha, correct answer. Monita, Geetu, Shanta, Shanu, Megha, Charles, Nimi, Shiny. Yes, previous one is from text C. And what about fifth one? Yes, Megha, which is mentioned in text D. Very good, Shanta, text D. Sixth one, how does taking different medications exacerbate renal function? So, my keywords, different medications, renal function or renal. Renal, which means kidney function, right? Yeah. So, how does taking different medications exacerbate renal function or kidney function? So, what about question number 6? Yes. Alright, Shanu, Shiny, Monita, Shanta. And what about sixth one? Very good. Answer is mentioned in text A. So, where is it mentioned? In text A. Use of medicines, yeah, here. That could damage the kidney, renal function. This includes heavier long-term use of pain relievers such as ibuprofen or whatever aspirin. So, answer is mentioned in text A. Yes. Yes, Rebecca, Shari, Shanu, Shanta, Nimmi, Monita, Shiny. Yeah, a lot of names starting with S. Yeah. Answer is from text A. Seventh one. Various modalities of peritoneal dialysis available. So, various modalities and available. Okay. It's not important to underline available here. You can underline various in modalities. What do you mean by various modalities? Various modalities of peritoneal dialysis available. What is the meaning of the word modality? Let me know in the comment box. Various modalities of peritoneal dialysis available. What is the meaning of the word modality, Shiny? Shanu, Geetu, Shanta, Rebecca, Megha. What is the meaning of the word modalities? Yes. So, in text B, as you can see here, varieties, modalities. Okay. So, answer is mentioned in text B. Yes. Yes, Megha. It can be sometimes kinds, methods, procedures, varieties, factors. Okay. Answer is mentioned in text B. So, let me know in the comment box, anyone got 7 out of 7 for first set of questions? Match the following. Anyone with 7? Excellent, Megha. You got 7 out of 7. I'm so happy. Alright, Shanta, very good. Anyone else with 7 out of 7? Megha, Shanta, Shanu, very good, Shanu. Yes, Shari, Nimmi, Shiny, very good, very good. Alright, so anyone with 6? Yes, Rebecca, very good, dear. 7. Okay, so we are moving to 8 to 14 set of question, that is short answer question. Okay, short answer question. What is the meaning of short answer? Very small answers. So, maximum you can write in 1, 2 or 3 words. Not more than 3 words. Maximum 3. Remember, maximum 3. First one. A constellation of maladies that could impact the renal segments responsible for blood filtration. My keywords, constellation, maladies and renal segments or renal. Yes, these are my keywords from 8th question. And this structure of the question, the sentence structure is little bit confusing and difficult because a lot of unfamiliar words for you, but it's very direct answer. Yes, eighth one. A constellation of maladies that could impact renal segments responsible for blood filtration. Yes. What is the correct answer? This is a short answer question, so we need a short answer here. Yes, answer is glomerulonephritis. Glomerulonephritis. And that answer is mentioned in text A. Yes, a group of diseases, maladies, constellation, which means a group. Okay, in the question, constellation, which means a group, diseases that could impact renal segments, kidney, responsible for blood infiltration. Answer is glomerulonephritis. Alright, answer is mentioned here, glomerulonephritis. Yes. Ninth one. What is the threshold age criterion? Already in the previous question. Okay, remember threshold, which means minimum age criterion for inclusion in the study cohort. Cohort here, which means a group, study group. So study group is mentioned in text D. So what is the minimum age mentioned here? Which is 18 years. So answer is 18 years. Yes, very good, Shiny. You got the correct answer here, 18 years. Very good. Yes, Megha, first one was mentioned in text A. Yeah, Shanta, very good, 18 years. Then 10th one. For patients finding repeated peritoneal dialysis inefficient, which alternative procedure might be advantageous? Okay, so my keywords: repeated, inefficient, alternative. So we need an alternative procedure for peritoneal dialysis. Any other alternatives mentioned for peritoneal dialysis? Yes, Rebecca, 18 years, Shari, 18 years, Priya, Shanu, Nimmi, 18 years, very good. What about 10th one? For patients finding repeated peritoneal dialysis inefficient, then you can do an alternative procedure. I think alternative procedures mentioned in text is C. Any other alternative procedures mentioned here in text is C? Incompetency, peritoneal dialysis become ineffective, keyword. After continuous, yes, another keyword, several years, patient then needs to change. Alternative method is hemodialysis. See, direct answer. Hemodialysis, which is the correct answer, mentioned in text is C. Yes. 11th one. Daily, at what frequency can continuous ambulatory abdominal dialysis be repeated? So, ambulatory, repeated. So, my keywords: frequency. How many times in a day? Daily. How many times in a day? Yes. How many times? Frequency. Answer is 3 times. Yes. Already day is mentioned there. So, daily, which means day. Answer is 3 times. Very good, Shiny. Yes, Shanu, Shanta, Sankita. Answer is 3 times. And it is mentioned in text B, again about a procedure. So, this procedure can be done, continuous ambulatory peritoneal dialysis can be done repeated 3 times a day. So, answer is 3 times. Yes, 3 times. 12th one. Within the cohort of individuals with depression, how many have undergone kidney transplantation? So, cohort, which means again group. Individuals with depression, how many have undergone kidney transplantation? A very direct answer from text D. Yes, how many patients are going for kidney transplantation here? Depression, renal transplantation, kidney transplantation, that is 16. So, answer is 16 from text D. 16 from text D. Renal transplantation. Due to prolonged presence of dialysis fluid, which anatomical region experiences strain? So, prolonged anatomical region. So, which region? Yes, which is the region or what is the site mentioned? So, it is from text C. Abdominal dialysis may lead to possible implications or complications. And what is the problem mentioned here? It can lead to hernia, and the procedure holds the fluid in the abdomen for a long duration, prolonged strain. Another keyword, abdominal muscles. See, Okay, anatomical region, which means abdominal muscles. That is the correct answer. The keywords very directly mentioned there. So answer is mentioned in text C. Abdominal muscles. 14th one. Yes, Shiny, Nimi, Shanta, Shanu, Meka, which is abdominal muscles. 14. How many hours must an individual remain tethered to the machine overnight in APD? So APD is only mentioned in text B. How many hours? Okay, so I'm just searching in text B. How many hours mentioned? 10 to 12 hours. Night. Remain attached to machine. Tethered. So answer is 10 to 12. Already hours mentioned there, so don't repeat hours. Answer is 10 to 12. Yes. 10 to 12. Oh, correct answers. Yes, Priya, Sankita, Grishma, Shiny, Geetu, Meka. Meka, not hours, 10 to 12. Don't repeat, okay? Yes, 10 to 12. 15th one. Fill in the blanks. Minimal count of sufferers exempted from research group had either dementia or dash. Dementia is mentioned, I think, which is mentioned in text D, right? I've seen dementia here. Yes. Exclusion. Dementia or psychotic disorder. Psychotic disorder. PSYCHOTIC disorder. Answer is psychotic disorder. 16. For individuals, the influx of extra calories from the dialysis solution may intricately contribute to heightened blood sugar levels. Increased blood sugar levels in dash. In what? In what? Heightened blood sugar levels in? What does that mean? Okay, without even reading, I think it is diabetes, right? Where is it mentioned? Diabetes, 16th one. I think so. I've seen here. Yeah, if a patient has diabetes, these extra calories can be lead to high blood sugar. We know that is diabetes, right? So answer is diabetes. Okay, a very direct answer from text C. And what about question number 17? So 17th question. Yes, very good, Mega, which is mentioned in text C. Very good, dear. Yes, correct answer. Then 17. Abdominal dialysis serves as a therapeutic approach, removing dash and impurities. Impurities, which means toxins, contaminants mentioned there. So what is another one? No, impurities, which means waste. So another one is toxins, that is contaminants. So answer is contaminants. Okay, which is mentioned here. Intervention takes away residues, which means impurities, and contaminants. That means in the toxins. Yes, not residues. Okay, another trick. Our trick not our. Yes, it is my prepared by myself. So it's not residues. Residues, which means impurities. Contaminants, which means toxins. Answer is toxins or contaminants. Contaminants is the correct answer. I'm so sorry, guys. Okay. Then 18th one. The dash autonomously instills the abdominal cavity with a solution before expelling the solution along with waste into a sterile bag, facilitating its retention. So what about this one? 18th one. Yes, contaminants. Very good, Shari. Your answer is correct. So question number 18. What is the correct answer? The dash autonomously instills the abdominal cavity with a solution before expelling the solution along with dash. No. Very good, Megha. Your answer is correct, which is cycler. Okay, cycler is the correct answer. And I think it's mentioned here in text. We have seen that word here, cycler. Yes. See? APD, also called continuous cycling peritoneal dialysis, involves attaching a catheter to a machine called a cycler. Answer is cycler. Okay, and the automated cycler performs multiple exchanges throughout the night while the person sleeps. Cycler automatically fills the abdomen with a solution, allowing to stay there. That is the question. Drain the solution along with waste into sterile bag. That's the question. Sterile bag is there, waste is mentioned there. So that answer is cycler. Okay, answer is cycler. Yes, autonomously, which means automatically. So answer is the cycler. 19th one. Apart from catheter-associated infections, an infection of the dash can ensue, which means follow or develop, consequence of peritoneal dialysis. Catheter-associated. So, catheter-associated answer is mentioned in text C. And catheter-associated, an infection of the abdominal lining can also develop due to peritoneal dialysis. So, whereas catheter-associated, an infection can develop near the catheter. The risk is higher if the person is not properly trained for the procedure. An infection of the abdominal lining. So, answer is abdominal lining. Very good, Shanu. Yes, Priya, Nimmi, Shiny, Shanta, Fazila. Hi, Fazila. Shari, Sangeeta, Mekha. Yes, abdominal lining. Answer is mentioned here. Okay, abdominal lining. Last one, 20. In CAPD, the patient connects a tube to the catheter, empties dialysis fluid into the belly using a bag, and then drains it all through a manual dash process. So, what process? And the first letter is M. Last letter is E. And there is a hyphen in between. So, let me tell you. Please tell me what is the correct answer. What is the correct answer? Any idea? Yes, answer is from text B. And I don't think that there is a hyphen. Yeah, let me check. CAPD is a machine free. Yes, there is a hyphen. Alright, so answer is machine hyphen free. Machine free. Okay. Yes, machine free. There is a hyphen. You have to write the hyphen, otherwise your answer is wrong. Okay, Fazila, yes, hyphen is there. Yes, Sangeeta, hyphen is there. Shiny, your answer is correct. Yes, Shari, Nimmi, Shanu, hyphen is there. So, answer is machine hyphen free. Machine free. Alright, that is mentioned in text B. So, that's that. So, anyone with 20 out of 20? I think no 20 out of 20, maybe 19. Because, yeah. No idea. Anyone with 20? Let me know in the comment box. Anyone with 20 out of 20? No. So, that's all about today. So, stay tuned. Happy weekend. See you on Monday.